Well, I guess I'm first on the list, so I'll give you a start off. If everybody could just kind of go ahead and mute, that would be lovely. And then as we go through this presentation, if there's besides your name, if there's other comments or questions that you can put in the chat, or feel free to raise your hand. We will have points later that we're actually seeking dialogue, but we're actually seeking dialogue the whole time. So do feel free to participate to the extent that you can, because you're really the fact that you expressed interest following our March 31st. Boy, it's hard to believe that was March 31st. Is indicative of your interest. So we want to thank you for jumping on. Just in a reason, a couple of quick comments for the initiative is to recap a couple quick comments. One is just understanding and embracing the interdependence of all of us in terms of our lives, our services. Certainly that moves over to healthcare and the community. And the more we can foster a sense of connectivity and purpose, particularly when you can rally it around a purpose, you can just move mountains a lot further than you can at any of us alone. So thank you for jumping in today and having a dialogue on some of our next steps following our convening in March on a community of care. The idea of a transformation strategy has always been involved with focusing on the person. What do the person's need? We all have markers that we do in our professional life or for ourselves, but in focusing our health on what is basic to the person and hearing from their point of view makes all the difference sometimes in having all the right factors come together for someone to thrive. So we really appreciate your joining back with us. Part of the emerging trends of why we got involved in this initiative was the importance of thinking of healthcare along with social care. And I don't want to get hung up on the term. Sometimes people say medical versus home or whatever, but it is the interdependence of our lives. What we found in our work in the last few years is probably underscored the sponsors of this initiative that you've seen, the Area Agency on Aging and Spectrum Health Lakeland, and broadening to the broader community, is that when people our medical partners are working to help someone with their personal health and thrive, there's so many factors in the home. So they naturally right nowadays are reaching to the home. The Area Agency on Aging, our work focuses on the home. And sometimes we see situations where, boy, we really need we're community-based clinicians. We need medical partners, and we really need that interdependence coming from both sides. We thought our trends are really emerging. And as we've found success in doing that, we have realized that we need to take that broader than just what we do and try to engage the full community. So that the focus around the action groups today and the purpose, and thank you for signing up, and is the beginning of an effort looking to just unify the efforts of the medical world and our home-based clinician world with the broader community-based supports and services. The Area Agency on Aging and Spectrum Health Lakeland will stay heavily involved in this, but we welcome you to work with us. The members on action teams are viewed as part of a transformation where you're asked to be a voice for the community, a source of knowledge about community resources and members, and a voice for complex care, because what a lot of the focus is of folks that have the hardest time thriving are those with very complex needs. So a voice for complex persons with complex care and their caregivers. That members of action groups can be ambassadors for people trying to thrive through their life. We all want to do as best we can and thrive throughout life, and bringing in, we look to action groups to bring in new information, increase public awareness, and share the group's vision, progress, and solutions. We may have trainings on different community topics as we go, and understanding the better some of the limitations that are out there in the community, where we can add support to solutions that are underway, or maybe discover areas where no one's focusing on a certain solution. So we're very excited about that. The pieces that I just mentioned are part of a charter review in thinking about why are we reaching out to you as action groups. So we're really excited about your willingness to partner with us. I think we're all stronger together. So we encourage the dialogue and respect that there's so much knowledge out there in the community. So thank you for joining with us. By that way of introduction, I'm going to move it over to Sam Fell from Spectrum Health Lakeland to talk about forming the intervention a little bit.
Thank you, Lynn, and thanks for that description of really why we're here. We really want you to engage. We want you to help us design from this visual, the shared plan of care. What are the things that we've, from a research perspective, we've gone out, we've asked the community, we've asked you, what are those gaps that we're missing? We've got these 2 action groups, and specifically focusing on some areas to help inform that shared plan of care. And know that this is an iterative process, right? These are, as for those of you who were able to call in to that meeting on March 31st, you saw that we have various phases that we're going to go through. We've got various patient groups that we're going to be looking at and dealing with and learning along the way. From that healthcare system, from that looking from a medical side of things, identifying those patients that we want to be involved in, and looking at the 4 M's of care, the what matters most to them, the medication, mentation, mobility aspects of things. How does that information help inform, as I say, that shared plan of care? Making sure that we have health goals that are achievable for the patients, the caregivers, and ensuring that we've got those smooth handoff before referral with our referral system. So looking for those gaps, hoping that you can help. And this isn't a one and done situation. We're going to be coming back to you over time to talk to you about the interventions that we're developing to help with all of these various things that we're going to be needing. What are those things that we might be missing that you can help us with and engage with? And from a community perspective, and this is this particular action group, helping to make sure that we are identifying all the things that are going on as part of this plan of care. What's going on in the home, assessing those community things that we're looking at. What are those needs? Again, combining it and understanding those goals and keeping that referral loop ongoing and making sure that, again, we're addressing those needs and we've understood the gaps. And we want to make sure that as we develop the intervention, we're helping to fill those gaps. What are those maybe communication points that we're missing? What are some of those social needs that we might be missing? Trying to develop, as I say, that overall holistic plan of care through interacting with these action groups, informing that shared plan of care. I'm going to pause here to ask you, what do you think? Does that make a lot of sense? What are our goals for these action groups? Anyone have any thoughts on that? All right, I'm gonna then, one of the models that we want to use as we're doing this, and I believe we sent out a PDF that talked about these 5 A's of integrating social care into healthcare. And that's, next slide, thank you. One of the things that we want to make sure that we're addressing are these 5 A's. So as we look at developing this plan of care, have we created an awareness? Do we understand what those potential social needs are as part of this? And then from our sort of plan of care side, what are the things that we can be looking at? Of course, there's opportunities for adjustment. In that plan of care, do we have the right things in place that we can address and adjust as needed? And if we can't adjust as part of that plan of, in that plan of care, can we assist our patients to get that work? So if it is transportation, have we got the mechanisms in place to assist them, like tokens for maybe dial ride or something to that extent? Do we have those mechanisms in place that we can help address those social needs in that integrated plan of care? And then, of course, you take from a larger perspective as we learn, what are some of the alignments that we have to do within the community? And I know that there are some people on here who've been engaged from a community perspective. There's a large community need for more transportation. How do we as a community work on those things? And of course, that then feeds into, and there's that symbiotic relationship in all of this work as to we can advocate now as a larger community of care. These are the things that we really do need to help, we need help with and advocate on as we work together as a community for the greater needs of our caregivers and our patients in our overall shared plan of care. So I'm going to pause there as well and really look for some feedback. And I don't know if there's some things in the chat here that we can be looking at as well.
I didn't see any comments in the chat yet, but folks can feel free to unmute as well and reflect on both the intervention schematic and how these 5As, this example, I appreciate this example, Sam, how this might feed into and be a way to think about our work.
Yes, as we went through, and I know that Debbie's going to bring up the variety of different recommendations that we have. Transportation was certainly one, and I know that, and Victoria knows, as we've been working from an ambulatory primary care side of things, this is something that is often called up, why patients are missing appointments and not able to miss it, where transportation is definitely a problem. So you're right, it's a very apt example. All right, if there are no comments then, or again, we really, at any point in time, please either raise your hand or speak up.
This is Melinda. I have a quick comment, which just is, I like this transportation example. And I think as we begin to look at recommendations later in our meeting today, but also in the future, be interesting to kind of use this model to work through, other things that we're wanting to address. So I think this is really helpful.
Absolutely. And
I appreciate.
Go ahead. I'm sorry. Go ahead.
Yeah, no, that's okay. I was just going to reflect on that. I appreciate that, Melinda. Sometimes the barriers or challenges that we're presented with or that are identified seem a bit insurmountable. So I like this framework to think about how are the different ways, these 5As ways that we can think about approaching barrier resolution.
And I just wanted to mention from an action group perspective, and again, we will be reaching out again to, this isn't a one and done type situation. We're going to be asking for some more feedback from you. And also, as I mentioned, this is a journey. We're going to be doing some evolving of this plan. And we're going to come back to you and visit with you again and say, how are we doing? As we work through all the recommendations and we take your recommendations and build them into a strong integrated plan of care, want to come back to you and reflect with you and say, are we getting it right? And again, understanding that it will evolve over time as we work through the various patient groups that we've identified as part of this. So really looking again for your engagement in this work. And just one other thing about those training opportunities that Lynn talked about at the beginning, there will be some further opportunities to many the 4Ms and the 5As and who knows how many different other acronyms we'll come up with over time. There will be training opportunities for all of us to engage in this work, to understand this work, to help really inform that work. So look for those opportunities as well.
And I would just layer on too, Sam, I'm thinking as I'm listening to you, I'm thinking about in all of our lives, whether it's professional or personal life, we come across people with complex care needs. Part of the purpose too is that building awareness across all of us and being ambassadors so that we understand, can work together better, but just understand all what's out there. And we have a caring community that's constantly evolving, and it's an ongoing process to keep us all up to date. So this would be a great forum for people to be able to share opportunities for assistance in the community.
And actually, that's a good segue into my slide. If you want to go to the next one, because this is our baseline data, right? We wanted a 360-degree view of complex care in our community. So there were 4 mechanisms by which we've sought their perspectives, and the first one was through the HARMS 8 survey, a patient perspective. to their complex care needs. And then we looked at the medical and community care management focus groups, and we learned what their perspectives were, as well as caregivers and the community-based organizations that you may or may not have participated in. So with that said, we received numerous pages, multiple pages of recommendations. And if you go to the next slide, we've grouped those into 2 themes, and you can kind of see the repetitiveness here of the action group 1 and action group 2. And this was pulled off of that schematic that you saw earlier. So the action group 1 is more of the healthcare system, community care management role in developing of care plans. I'm not going to pour into this because we have, we're looking forward to some really robust conversations regarding the recommendations in a moment. But this is just basically showing you the parceled out action groups. The action group 2 is what this group is what this call to action work group is. And so we would be looking at things like workplace support, community support and initiatives. Where are the resources coming from? Local, state, federal, what are those? Volunteers, technology, skills, and access. So all of those recommendations are summarized into numerous themes and with 2 action groups to address those items. Action group 1 is a whole different set that's not part of this group here, but will be integrated. But to continue to work on these recommendations, that's why we need this separate work group here, of which you're on, and we are grateful for. All right, I think that is, next slide, please. I think Melinda, you're next on this one.
I am, and it's also 3:20 in the afternoon, so it's time for a 3:20 stretch. Everyone can stay in their chair, but yes, Christine, everyone put your arms up if you can and stretch a little bit, one side or another. Put your arms, okay, this is my goal, to have you stay awake while I talk for a few minutes. So thank you for doing that stretch for a minute. So you've heard about already the purpose of the community-based action group, which is all of us here, all of you, and the desire to create a shared care plan with the supports that people need to have the care and support that they need in their home. So, and Debbie just talked about how we got perspectives from multiple groups through data collection, surveys, and focus groups. So much information. It's been boiled down into 29 key recommendations. 29 is a lot. Actually, we had to count it several times because every time we counted it, we came up with a different number, but I'm pretty sure it's 29. And those 29 recommendations fall into these 5 categories on the slide. So I'm going to go through this quickly just to give you kind of a perspective of the recommendations in each category. So we had 4 recommendations that fell into the workplace supports category. And mainly those seek to educate employers and increase supports and programs for caregivers. We had 7 recommendations that are in the community support initiatives category. And those recommended the creation of programs, expansion of services, and resolving barriers to accessing these services, including behavioral health. We had 9 recommendations in the resource development and advocacy category. And this category is further divided by local, state, and federal levels. So these recommendations centered around increasing or better designating funding, as well as advocating for special needs. There were 3 recommendations in the volunteer category to expand volunteer services and increase training and technical services or technical assistance. And then finally, there were 6 recommendations in the technical skills and access category that really seek to help develop technology platforms, infrastructure, as well as increasing access to broadband and expanding opportunities for virtual care. So like I said, so many recommendations. Given the amount of recommendations, we'd like this group so all of you, to help prioritize these recommendations based on impact, effort, those who are already involved in addressing this recommendation, or those who should be involved in addressing the recommendation. And then using this data that you provide, we'll come back together to use that to prioritize these recommendations. So I'm going to hand it over now to Christine Van Landingham to further explain and take us through the process. Thanks.
Thanks, thanks, Melinda. This is where it gets really exciting, because this is where we take the work of the planning grant year. So with all that effort that went into those surveys and the wonderful work that my colleagues summarized for you, and take that to the next level. So we have, as Melinda said, we have 29 recommendations for this action group to consider and to help further inform and prioritize. So how does a community go about prioritizing or implementing 29 recommendations? So this is a participatory activity. So get ready for this. What we're going to do is talk about a process for evaluating those 29 recommendations, and we'll do it on this grid. So we'll rate the community impact. How much impact would it have in our community if we were able to nail this recommendation and implement it? 1 to 10, 1 being low, 10 being high. And level of effort. So is this an easy lift, 1, 2, or 3, or is this going to take something that's a lot more effort, all the way to 10? And then we'll invite the input of this action group. And as you're ranking these recommendations, and have no fear, we're not going to do all 29 of them today. So as you rank these recommendations, we also want you to think about who else do we need involved in this, or who else is working on it. If you go to the next slide for me, Peg. This is an example of one person's ranking of the 29 recommendations. So every X is where this one person's perspective fell on all 29 of the recommendations. And you can see that one of them fell in that quadrant of fill-ins. I didn't. Peg, can you go back for just a second? Back one. Just wanted to see the lower quadrant as we plot these recommendations out. If they fall in that lower left-hand quadrant, we might think about, okay, those are fill-ins. We might do those. They're low impact, but they're also low effort. So we might do that. As we look at the top left quadrant, those quick wins, those things are back, Peg. The quick wins, those things that we would want to do right now because they have high community impact and maybe not so much effort. And then if you look at the bottom right quadrant, if something is a high level of effort but low community impact, we might not do that. Or we might just really put that on the shelf and think about that for down the road for evaluating, can we make this a higher impact? But then up in there in the right-hand quadrant, the blue square, that's where things that are going to have huge community impact, but it's also going to take a lot of effort. And you can see those are tagged major projects. Be selective. We need to make sure we're not, as a group, taking on too many major projects all at once, but really prioritizing those. Now, if you would go to the next slide for me, Peg. This one person's perspective, most of those recommendations, where did the majority of them land? Up here in the high right-hand plot. And that might be absolutely right. But from this person's perspective, many of these recommendations have high impact or going to take high effort. What we're going to need is the input of a broad group of community stakeholders and broad spectrums so that we can make sure that maybe the one that's in the low quadrant, maybe for others, rises really high. So we want to make sure that as we plan our intervention and our activities for this group, that we make sure that we're not just operating on just one person's perspective, that we get the big 360 view of these efforts. So what we'll be asking this group to do, you will be getting some homework. We will be asking you to rank the recommendations, but first we're going to do 2 of them together. We're going to do this as a group. It is your turn now to get participatory here. So I'm going to ask our assistant, whether it's John or Peggy, to launch the first poll. And I'm going to ask you to think about I'll wait for the poll to pop up there. think about the community impact. First, just the community impact of this recommendation. Identifying behavioral health supports, gaps, and barriers, and work to resolve those barriers in collaboration with behavioral health. Would that have low community impact, 1, or all the way up to 10? And after you vote, you might also stick in the chat some thoughts about who else should be involved in this work, or who else is already involved in this work, if you know anyone. But who else, what other perspectives should we get? I've got 5 responses, 6, so we'll let that go a little bit longer. What's the community impact of identifying barriers in terms of collaboration with behavioral health and access to, and working to resolve that? Okay, looks like we've pretty much, a few more coming in. And then once you vote, if you want to slide over to the chat and say who else, if anyone, should be involved in this part of our work, or who else is working on it. Almost there, 17 of 20. One of them might be me who's not voted yet. So, all right, I will end that polling and share those results. So you can see that the majority, 29%, ranked this a 10, and another 24, 9, and 12% 8. So from the perspectives of this group, some saw that as a lower impact from your view of the world, and many a higher view. So that's really helpful, and we will plot that on our chart. And then we'll look on, in order to plot it on the chart, we need to know the bottom piece of that information. So if you launch the next, thank you for telling me that, Valerie. You can scroll down when the poll launches. It does go from 1 to 10. So if you only see 7, go ahead and scroll down to 10. On level of effort, please rank the level of effort it might take to identify behavioral health support gaps and barriers, and work to resolve those barriers. So do recognize, mine stops at 8. Do recognize you can scroll down and you'll see 10. So rate from your perspective what level of effort it would take to accomplish this priority. Already up to 10, half of you have responded. You can use some of this time also to enter in the chat. If you ranked it at 8 on the first one and you wanted to do 10, you can put that in the chat as well if you missed that scrolling. Just another minute or two, you can scroll down there. Thank you. I see Disability Network was suggested as someone who should also be involved in this work. Thank you. 211, great suggestion, Victoria. Good. All right, we've got 3 more people. I'll give it just another moment if others want to vote. Okay. All right, I will end the poll and share some results. So here, while this group thinks it is high impact, also thinks it's going to take some heft. The largest percentage was 8, and still some 9s and 10s in there. So you can see that this would launch. This would land in our higher quadrant. This would land in the blue as a major project, and something that would certainly have high community impact and take quite a lift to do, which is okay. That's why we're convening these groups, because we need the players and the people who can make impact. That's what we're going to do with all 29, but we're just going to do one more together. And if you would launch the next poll, please. So please rate the community impact of developing a technology platform to connect caregivers with resources. So would there be small, medium, or significant community impact if we were able to develop and launch a technology platform to connect caregivers to the resources and supports they need? And after you click your vote button, feel free to slide over to the chat box and indicate either who's already doing this, or who else should be, or who else should be involved in the conversation. All right, we have a little over 2/3 have voted. We'll wait just a few more moments. I love seeing these come in the broad perspective for, and this speaks to the value of having broad perspectives. Okay, all right, I'll end that poll and share those results. You can see that it ranks everywhere from 3 to 10, and with an average of 35% saying 6. So that's, again, a really cool value of getting a broad perspective. If we only had one perspective, it might land at a 3 or a 10. These will be averaged out, so we will make sure that we plot accordingly. All right, we'll stop sharing that and we'll launch the next poll. What would be, go ahead and look, there you go. What would be the level of effort to do that? What would be the level of effort it would take to develop a technology platform to connect caregivers with resources? 1 being low, 10 being high. And if you haven't had a chance yet to, or if more ideas have populated, who else should be involved? Who should we tap? Who should we make sure is involved in a effort like this, if this is one of the things that we decide to tackle in our priorities? There's some great comments coming in, great suggestions and ideas there. Okay, 85% have voted. So last call for votes. I'll end the polling and I'll share the results. And again, a broad spectrum. It lands at about an 8. It would take some effort, but others have some thought that it might not be as hard. So we might get in some perspectives of how would we go about this? So I will stop sharing and we will capture all the comments, all the thoughts and ideas in the comments section, and be sure to include those as we move forward. Now, if you could go to the next slide for me, Peg. There. So what we're going to do to be able to now take, so you've had a little practice at this. You're going to get, as a follow-up to this meeting, you're going to get an email from Peggy, and it will have survey links. You saw from Melinda's piece that these 29 recommendations are grouped in 5 categories. So we kind of break it down. So we're not asking you to do all of these at once, but we're going to ask you to click on the survey links and rank each one of these recommendations on that quadrant. What level of effort would it take, and what would be the community impact? Also, it is an opportunity for you to, yes, also tell us who should be involved, but you are welcomed and encouraged to share those survey links with others. You have access to a network of perspective in the community that is unique to you, and we need everyone's voice in order to really make sure that we're hearing from the community what our priorities should be. So please do share those links. I appreciate that Peg went all the way to the trouble to even tell you how many minutes it will take to do each one of those surveys. So you don't have to do them all at once. You can come back to them and tackle them one at a time. But that is your homework assignment, is to watch for that email from Peg and complete those and help us to plot and to begin to put these recommendations in some sort of grid where we can begin to make some decisions about where do we prioritize and who do we need to bring in to make sure that we're, one, not duplicating, that we have all perspectives, and that we build on the work that's already going on in the community. So you'll get that. Please do share the link with others. Please complete it by July 9th. I think, Peg, what was the total time of all the surveys? I put your math skills to the test really quick. I don't think any of them were more than 9 minutes. So it's and some of them were shorter than that. So I think we can do that by July 9th. We do have a next meeting for this group. So we will have all of those rankings back, and we will plot those out. So you'll see the next iteration. You'll see how your rankings fell with others and where all those recommendations landed inside of that. I will say also, As you read the recommendations, if there are questions, if you're not sure, what does that mean or where did that come from? There are links in that email that Peg's going to send you to information about the surveys and the studies that came together to bring those recommendations together. So we'll do that on July 29th at 3:30. So I hope you get that date and time on your calendar. I hope as you have, as we continue with this conversation today, and as you do the surveys, you think about who else should be at that meeting, not just who else should get those surveys, but who needs to be on this action group so that we can make sure that we have broad representation in the community. So I've talked a lot at you right now. I appreciate your participation. This has been really cool to see the varied perspectives and to see your ideas populating in the chat. But I'd like to open it up if you have thoughts, if you have questions or comments about what we're working on, what we're accomplishing, or what you heard today, or anything from my colleagues who'd like to say something that I forgot to say.
Or if someone feels a pressing issue that we want to make sure we are addressing, that it might be in the 29, but feel free to share that as well.
Absolutely.
Well, I'm just very excited about the collaboration and bringing the medical and community-based partnerships together. It's a long time coming, I think. I think we've all made incremental progress over the years, and it's exciting to have it reach this point where we're all so engaged and wanting to move it forward. It's awesome, and you guys have done amazing work so far. I love the A's. It's looking great.
Thank you, Teresa. I see someone says in the chat, I love the homework. What I hope that you feel and see and know is, and can grasp, is how your voice in this is so important and how it will help shape the direction of the effort. So I echo your sentiments, Teresa. It's really cool to see this group come together and have meaningful dialogue around how do we take action in our community that builds on what already exists, but identifies and brings people together to resolve gaps and barriers.
I have a comment, which is great job, Christine, and thank you everyone for your input, and great job everyone who's spoken up so far. I do wonder if we need to look for more people who are actually, experiencing these challenges. Lots of us work with individuals who maybe, we've seen them experiencing these challenges, but actually the people who are experiencing them or the caregivers.
Getting that lived experience, right? Yeah,
and so, I kind of wonder if when we look at the people in this meeting today, if, we can encourage them to think about, who could share that real perspective and be part of prioritizing from that lived experience perspective.
That's a great point. And while you can certainly share the survey with anyone, you could also, if there's a caregiver or there's someone with lived experience who might struggle to just get the survey link and fill it out, you could do that with them and get that perspective as well. That would be incredibly valuable.
Here's a comment.
Because we all have our fingers on different maybe support groups or different resources that we just may not know about. And Angela entered in, the Alzheimer Association.
Yeah.
And Angela, I don't know if you want to speak to that a little bit more, but there's always things that we just may not know about. So.
Yeah, I just thought of that group, and I really appreciated what Melinda said, because I immediately am thinking of a friend of mine who's really struggling for some help. The situation has been amazing. When I listened to her, all these ways she's trying to get help for her daughter, and there's just no behavioral health support available. It's been amazing, and she's very knowledgeable, and it's been just a lot of dead ends and blocked roads. So she would be someone I would share this with for sure. So
that's a fabulous example.
Mm-hmm.
So as you get the survey and you look at the 29 recommendations, as those aha moments happen, do two things: share the survey or help facilitate that, and invite them to the next meeting and capture that. Even if that person can't participate, it'll help us think about, okay, how do we capture that voice in that perspective?
And of course, we need to know who that voice is. So
Yes.
let us know, who you're transferring that survey to and sending that survey to.
That's a really good point. When you share the survey, if you could let Peggy know, we're trying to funnel communications through Peggy Schaefer. So if you share that survey with half a dozen people, if you could let her know so that we can kind of get a sense of, because the survey is anonymous, correct, Peggy? Correct. So knowing what perspectives we're getting would be really helpful. Guardian organizations, awesome example. Mental health counselors, good. All right. Well, I'm hopeful that this has gotten your creative juices going and that you're beginning to think about the work. Peg, can we share the slides with this group? I don't know if I think you have email addresses for these. We can perhaps at least share that schematic. I want you to think about the intervention as Sam articulated and where this action group falls in that, and know, again, as Sam said, this is an evolution as we build our intervention, and it's going to take all of us to get to that final product.
Well, one more thing, Christine, in the email that everyone will receive, there's one last survey, not to put too many surveys for you, but we will be doing the similar process with action group number 1. So if you have an interest in participating in that group, as well as action group number 2, you will have a choice to sign up to make sure that we can send the invitations out to you if you're interested.
Thank you, Peg. I knew there was something I was missing, and that was it. So in that survey, it'll be an opportunity for you to sign up for either or both action groups. We're making an assumption you're in action group number 2 because you're here and you're participating, and we value your perspective. But you will also have the opportunity to sign up if your work crosses both community-based side and the clinical side of care management. You don't have to choose one or the other. It can be both and. Okay, with that, any final thoughts from the big 5 or anyone else?
Well, it's just one last thing. I'm kind of a research geek. And if you guys notice any or run across any articles or in the literature about your specific area and the medical and social integration, please send that along to maybe Peggy, and Peggy can shoot that out to the group or something. Just kind of keep your eyes and ears open about what's happening out there nationwide, globally too. That's all.
It's a great example how health happens in the community and how it integrates or doesn't with the healthcare system, and how can we make that happen. So best practices or good ideas are welcomed. Okay. All right. I think that no one will be disappointed if they get a few minutes back in their day. But this has been really good. I really appreciate the input and look forward to seeing you and many others on July 29th at 3:30. And I'm really excited to get those surveys back. So when that email from Peg lands in your box, please do set aside a little bit of time to take those surveys. It's going to have big impact. All right.
Thank you for attending.
Thank you.
Thank you.
Bye.
Bye.